Hi, my name is Dr. Chris Mertz. I'm a neuropsychologist at St. Joseph's Hospital. As a neuropsychologist, I specialize in assessing brain behavior relationships such as memory and attention and vision and speech and problem solving and thinking and all that kind of stuff, but also personality and behavior as well. As a neuropsychologist, I have a doctoral degree in psychology. Most neuropsychologists have either a PhD or a PsyD from an accredited university by American Psychological Association. Neuropsychologists also have specialized training postdoctorally in the form of fellowships, mostly 2-year fellowships. I completed my doctoral degree at James Madison University in Virginia and a postdoctoral fellowship at Cooper University Hospital in Camden, New Jersey for 2 years before moving to Minnesota. I've been part of HealthEast neuropsychology departments since 2008. Last year, 2012, we opened up an outpatient clinic at St. Joseph's Hospital, and I assess neuropsychological functioning on both an outpatient and inpatient basis at this time. I'm part of a delirium team that is attempting to minimize and reduce the risk of delirium in our acute care hospital settings. Delirium can extend hospital stays and increase risk for further medical complications. We have put together the screening assessment tool called the DEAR tool, D-E-A-R, which is the Delirium Elderly at Risk, is what that stands for. The DEAR tool comprises several different risk factors and criteria to be assessed prior to a patient entering into a hospital at this point on a preoperative basis. Some of the factors involved include a history of delirium previously during a hospital course, in which case the patient is automatically included in the at-risk group. For others who have not had histories of delirium previously, they must meet the 2 additional criteria in order to be placed at the within the at-risk group. This includes an age of greater than 80 years old, sensory impairment such as hearing impaired or vision impaired, functional status deficits such as needing assistance with bathing or dressing or grooming, toileting, feeding, that kind of thing. Substance abuse histories with 3 or more drinks of alcohol per week, or taking benzodiazepines, either prescribed or unprescribed, 3 or more times per week, such as Xanax or Klonopin or other commonly prescribed medications. Finally is the cognitive portion of the DEAR assessment, which is the clock drawing test, which we're going to talk about in more detail now. The clock drawing test is a common assessment tool used in neuropsychology and in other disciplines that look at cognitive functioning. It can assess many different things in a short period of time. And it's fairly simple to understand and comprehend once you're exposed to it. Initially, it can be a little daunting, and that's why we want to provide as many samples of how to score the clock drawing test appropriately. The DEAR tool itself will have guidelines on how to score pass versus fail on the clock drawing test. And what I wanted to show you now is some common samples of passes and common samples of failures for the clock drawing test. It's quite likely that you're going to run across several examples from patients that are beyond what we can cover in the scope of this short video, or even on the DEAR tool itself. But what we hope is that with experience you'll be able to determine the difference between a pass and a fail relatively easily. Okay? So let's talk about some passes for the clock drawing. Obviously, if somebody draws a clock that has the numbers correctly spaced and the hands correctly indicating the time, with the instructions being for 10 minutes after 3, then they're considered a pass on the clock drawing test. There are many examples of when you can make mistakes on the clock drawing test and still be considered a pass. So with the instructions of please, I'll read the instructions exactly as they appear on the Deer tool. Please draw in the numbers on the clock face in order for the time to read 10 minutes after 3 o'clock. You can repeat these instructions as often as you like and answer questions as long as you are not indicating what the proper responses should be or what the answers should be. You do not need to cover up timepieces or clocks in the room. If they want to use that, that's showing good judgment and problem solving on their part, and probably an indication of some intact cognitive functioning. You can see what they will have is a clock circle provided for them, and they are to put in the numbers and the hands. So let's look at some samples of the clock drawing where mistakes are made and yet it's still considered a pass. In this example here, you see that there's a number missing. They didn't put in the number 7. But everything else is spaced appropriately, and the hands are in the appropriate spot, depicting 10 minutes after 3 roughly. This is still considered a pass, even though there is a missing number. If there is more than one number missing, however, it's considered a fail. Here's another sample where there's no differentiation between the hour hand and the minute hand. They're both the same size. That's still considered a pass. No other gross mistakes are present. They can also have a reversal of the hour and minute hand, where the minute hand should be is shorter and vice versa. That would be considered a pass as well. On this sample, you can see there are some spatial errors. They've crowded numbers 12 through 5 and 6 through 11 into representative areas on the left and right, with some spatial abnormalities. But this is not grossly out of proportion to what a clock would be. I'll show you an example of a fail of spatial placement of the numbers in a little bit. But this would be considered a pass, and this is quite a common presentation. Here's another sample of a pass where you have someone who has drawn the hand to 3 appropriately, but directly to the number 10. You're going to see this quite often. This is probably the most common mistake on the clock drawing test, because the instructions are for 10 minutes after 3. People will be drawn to the number 10 because we include that in the instructions. That is still considered a pass on the Deer version of the clock drawing test. Anytime you can see the hands are in a plausible position, that is, the time depicted is any possible time that a clock could physically represent, it's considered a pass. So even if the hour hands and minute hands were way off, it's considered a pass for the Deer. Okay. Now I want to show you some samples of fails on the Deer. Now here's a sample where the clock numbers are placed appropriately around the clock face, and in fact 3 and 2, the appropriate numbers, are indicated. But as you can see, the hands are not depicted in a physically plausible manner. You don't have clocks that point inward from the outside. Unlike the clock previously, this could not be physically represented on an actual clock, so this is considered a fail. Other forms of similar mistakes include drawing a straight line between the appropriate numbers. This indicates that they're aware of what they're supposed to do, but they don't have the numbers centered in the middle of a clock like it's supposed to be. You can also have people drawing a straight line from a 10 to the 3, or any other depiction where the center of the clock might be way up here, or just way off course and no center distinction in the middle. Okay, that's considered a fail. This is another common fail where the person obviously knows the numbers that should be included, but instead of drawing in the hands, they've simply circled the numbers. In this sample, they've given a digital representation of 310. A lot of times you'll see that right in the center of the clock, or even down at the bottom of the page. Regardless of where it is, that would be considered a fail. In this sample, everything is appropriate except the numbers have been reversed. Even with placing the hands appropriately for 10 after 3, this would be considered a fail because of the reversal. Now here's a sample that I spoke about earlier where numbers are grossly out of spatial relation to what a clock should be. They've all been bunched on the right side of the clock face. This is not an uncommon presentation for some people. If you notice, if you're looking closely, you also see there's a second mistake on this clock that would be considered a fail. There are two number 3s, suggesting a perseveration of number depiction. That would also be considered a fail. This is another sample of perseveration of numbers where the person has started out appropriately labeling the clock with numbers, but then goes well beyond number 12 and all the way up till they run out of space. This is not unusual for someone with delirium or at risk for delirium because they lose track of what the task is in the middle of it and just begin numbering until they run out of space. And here's another sample of perseveration like the other one, where you have two number 3s or two number 8s. When there are multiple numbers, regardless of where it is, that's considered a fail. And regardless of why they did it, it's considered a fail. The last sample we'll have for a fail, if this thing cooperates with me, is where the numbers actually fall outside of the clock face and there are obvious spatial errors in the depiction of the numbers. There'll be other samples where it's just an obvious fail, and you'll recognize this by there's just a vague representation of a clock. There might just be scribbles or a complete lack of representation of what should be presented in hands and numbers. I want to show you another common presentation that should be considered a redo. When patients, otherwise everything on this clock is appropriate as far as the spacing and the number of check marks, but they have not put in numbers. What I would recommend you do in this case is give them a fresh start and say, I want you to draw the clock face and include the numbers in the representation, and then you can grade it accordingly. It's probably a good rule of thumb that if in doubt of how to score the clock, ask a colleague who might be familiar with it as well to see what their opinion is and see if you have a consensus on how to score it. If you're still having confusion or you don't have anyone to contact, it's probably a good idea to consider it a fail. And if that is the thing that determines they are at the high-risk group, then that will push them over. So if it's right on that cusp and you're not sure, it's best to consider it a fail.